afternoon, everyone. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Welcome to our webinar, Cool Caps and Comprehensive Care, Comfort Cancer Patients, presented in collaboration with Friends Health Connection. During today's webinar, we will be talking about scalp cooling treatment for cancer patients, as well as two new programs introduced at Robert Wood Johnson University Hospital, Somerset. A high-risk breast cancer screening program and a second opinion program. Our guest today is Dr. Kathleen Toomey, an oncologist who is the medical director of the Steeplechase Cancer Center at Robert Wood Johnson University Hospital, Somerset. Thank you for joining us. We will begin our webinar with about 20 minutes of a moderated discussion, and then we'll open it up to questions and answers from our audience. So once again, welcome, Dr. Toomey. Can you first start off by telling the audience a little bit about yourself?
So I'm a medical oncologist. I mostly see breast cancer, although I do see other cancers. And I have been at Robert Wood Johnson Somerset since 1987. And I am the medical director of the Cancer Center, so I oversee all our multidisciplinary teams, including our breast cancer team.
Well, thank you. I know you wear a lot of hats, so thank you so much for joining us today. So one of the potential side effects of chemotherapy is hair loss. Why does chemotherapy make a person lose their hair? Why does a person's hair fall out? Does this always happen?
So the way to think about it, I think, especially in this time of COVID, we know that, people can't get their hair cut. So what's happening to their hair? Their hair is growing. And I'd like to take a scissor. My husband cuts my hair, but I'd like to take a scissor to his hair. He won't let me. He won't let me touch it. So hair is growing because 90% of the cells are turning over. And the way chemotherapy works, it works against dividing cells. So we can think of it that way. Your hair grows. It's a rapidly dividing area of the body. So chemotherapy affects rapidly dividing cells. Now, it does depend on the chemotherapy. Different chemotherapies have higher risks of hair loss. It also depends on the patient. So it might be that a young man might not lose his hair with the same chemotherapy that I give a middle-aged lady. So it depends on the chemotherapy. Some chemotherapy drugs, it's about 100%. Some it might be 1 in 10 loses their hair enough that they have to wear a wig. So it really depends on the patient and the chemotherapy regimen.
Thank you for that explanation. So to prevent hair loss, the Steeplechase Cancer Center now offers Paxman Scalp Cooling Technology. Dr. Toomey, I know that the cost of this treatment has been generously supported by a lead gift from you, so that many or any patient at the Steeplechase Cancer Center can have this treatment free of charge. So that's so generous. Thank you so much. Why was that so important for you to offer this for patients?
So, psychologically, hair loss is, the thing that makes you a cancer patient in many people's eyes. It's the thing that patients worry about the most. From a doctor point of view, for me, it's just cosmetic. Yes, you can wear a wig, your hair will grow back. But, for patients, the psychological damage that it can cause can be very, very, very tough to take. And then everyone knows. It's sort of like you lose your anonymity about what's happening to you. So it depends on the patients. Some patients, it's not as important. To others, it's very, very important. So, I follow the lead of the patients, however my patients are feeling, and to validate, those feelings. So the Paxman was actually developed by a gentleman whose wife had breast cancer, and she had metastatic breast cancer, and she kept getting different chemotherapy regimens and kept losing her hair. So I think, especially for our patients who have metastatic disease where we're not curing them, they have to live with treatment the rest of their life. I think it really makes for a much better quality of life to be able to keep your hair. So that's why I thought it was important, and I really like to help my patients. So that's why we're doing this, and help everybody's patients, basically.
Well, that's very kind, and that makes you the kind of doctor you are. So thank you very much. So let's go into scalp cooling. What is scalp cooling and how does it work?
So as a matter of fact, Mr. Paxman, who developed this, worked in I think engineering or manufacturing, but at any rate, worked with a system of cooling. And so he realized he could take that cooling system and make it possible to cool the scalp. For years, there were many different kinds of scalp cooling things that maybe worked, maybe didn't work. But what they did is they went and did clinical trials to make sure, number one, how well it worked, and number two, that it was safe, and it was cleared by the FDA. So what it is coils, cooling coils that go right on the scalp, and on top of that is a neoprene cover that keeps it on, and then a headband to keep it comfortable. So what happens is patients come in, and for 30 minutes they're prepared. So they put they actually wet their hair and put some conditioner in it, put on this cap, and then for 30 minutes before they get treatment, their scalp is cooled. And I think the cap is 28 degrees, and they cool the scalp down to 64 to 71 degrees. So that's the first 30 minutes. Then you get the chemotherapy. Now, the first 30 minutes, you might be getting your pre-meds, so your anti-nausea medications, your antihistamine medications, your steroids, you're getting that during the 30 minutes. But then the next part is you get the chemotherapy, however long that takes, and you keep the cap on then for 90 minutes after. So it does really make your time of treatment longer, and that's certainly the downside of having a much longer treatment. But after that 90 minutes, 5 minutes you wait, and then that's taken off. You go home and you wash your hair, and the idea is to reduce the amount of hair loss. Now, it's not 100%. It doesn't work for everybody because it depends, once again, on the patient, and it depends on the chemotherapy. And for some chemotherapy medications, it works more often, and then for others less often. But on average, it works about half the time. So about half the time, patients don't lose their hair so that they would need to wear a wig. But half the time they do. My main concern, I'll tell you from a medical point of view, I'm more concerned about permanent hair loss. So in general, patients don't lose their hair permanently, but there are some drugs, like one drug called docetaxel or Taxotere, that can have permanent hair loss. Now that is a disaster for any patient to have permanent hair loss. Doesn't happen often. So the hope is, and the belief is, that with this kind of treatment, that you can avoid that. So even if the patient loses their hair, the hair will then grow back. And that takes about 6 months for patients to have their hair grow back.
So Dr. Toomey, I just wanted to go back to kind of the process a little bit, if you can
Sure.
kind of clarify. So a patient may not be hot or get kind of a heat flash, if you will, at the time that they're getting the treatment. But does this scalp cooling actually help them to delay or get overheated later on?
Oh, from a point of view of side effects you're talking about now?
Yeah, like, are you trying to, does the cap keep them cool after the treatment? Like how many hours?
Yeah, so well, the thing that it's not about, so yes, the cap makes you cold, right? If you have something cold on your head, you get cold. So people are advised to dress warmly. They can get up, they can go to the bathroom, except for that first half hour. They're asked not to get up for that first half hour, but after that, they can go to the bathroom 10 minutes or less. Can be unhooked. They're hooked to a machine that's circulating the coolant. And from a point of view of side effects, obviously, the first thing is the coldness on the scalp. So it is possible to have some scalp problems, especially if you've lost your hair. Remember, the hair is very insulating. I know when my patients lose their hair they realize how cold they can get. They really feel they really feel the cold. So if you have the cold right up against the scalp, you can get irritation. You could even have ulcerations. Doesn't happen very often, but that's the damage that you worry about locally. The main side effect is an ice cream headache, right? We take ice cream and we get that headache. That's the main side effect. So they may feel some chills. They may get a little dizzy. They can have the headache. Some people get a little nauseous. Usually they develop a tolerance to that. So after 10 minutes or so, they feel better. Sometimes they can feel a little sinus pain, like that sinus headache type problems. And then there are the skin stuff. Now, for the skin stuff, if you have a bald area, then you can just cover it with a little gauze or something to prevent the skin stuff from happening. But in general, it's well tolerated. I think, we talk to patients all the time, what's the risk versus the benefit of anything they do? And I would say for most patients, the benefits far outweigh the risks. So it's fairly safe. The main thing is to tell patients it's not 100%. So we can't promise that it's going to work for everybody. But most people are happy with whatever it is, whatever they get out of it.
So how long does the scalp cooling take? How long is the treatment? How long is that process?
So once again, it's a half hour.
Okay.
And then while you're getting chemotherapy, so it depends. Let's say your chemotherapy is going in over a half hour, over an hour, over a couple hours. So however long your chemotherapy normally is, that's how long you're going to get the treatment, plus 90 minutes after. So from a nursing point of view, because our nurses are the ones that administer this, while they're getting chemotherapy, they're obviously in our infusion suite, they're getting their treatment. But once they've finished the chemotherapy part of it, they could be potentially moved to another area to wait, sort of a cooling lounge if you want. But either way, either they stay in the infusion suite or they move, it's fine. They're okay. So from a side effect point of view, we're not worried about allergic reactions or, people terrible, passing out or anything like that. People do just fine. It's pretty simple.
Who would be an ideal candidate for this?
Okay, so somebody with hair down to here, somebody with long hair for whom hair is very important to them. I find young women, but not always. Somebody for whom keeping their hair is important. Number one, from my point of view, once again, the people I worry about the most are people getting this drug docetaxel, because permanent hair loss is permanent, and that's horrible. Once again, it doesn't happen very often, but I'd like to prevent it from ever happening, because I have maybe 5 patients in my practice, if that, who've had permanent hair loss, but it's something they have to live with the rest of their life. We are wig all the time. It's very, very tough situation to be in. And it was something we weren't always aware of in the past.
So how effective is it in preventing hair loss?
So I've spoken to some of the people who have done the clinical trials, and especially, asking them about permanent hair loss, and they seem to feel that it really prevents that from happening. It's hard to know, because you'd have to, study every single patient, but I have the feeling that that's very possibly true, that you're at least avoiding the permanent hair loss, if not hair loss during the treatment. But for some patients, they avoid hair loss completely. And once again, for those patients that have to have chemotherapy for the rest of their lives, having to live without hair for the rest of your life, not so fun.
Yeah. So I think you may have touched upon this a little bit, but are there any potential side effects to scalp cooling?
So once again, local side effects, any sores, itching, the ulceration of the scalp, mostly in areas where there is no hair. Remember, you can lose part of your hair and not the whole hair, so there could be patches that might be more at risk. And then feeling cold, the side effect of the ice cream headache type side effects. So those are the major side effects.
Okay, thank you. So as the COVID-19 pandemic winds down, the Steeplechase Cancer Center has resumed offering screening services such as annual mammograms. Women who come for a mammogram at the Santa Fe U.S. Breast Care Program will be screened to determine if they are at high risk for breast cancer. So Dr. Toomey, can you tell us more about the high-risk breast cancer screening program? Like, how do you determine if somebody is high risk, and what follow-up do you do for the women who are high risk?
So when women come for a screening mammogram, they're asked questions about their risk factors. So how old were you when you had your first child? Have you ever had a child? Any relatives in the family, mother, sister, daughter with breast cancer? Any ovarian cancer in the family? Any use of hormone replacement therapy? So many different questions are asked because these are risk factors for breast cancer. Obviously, being a woman is the biggest risk factor for breast cancer. And we have models that we can use to tell us whether or not this woman fits in a category that may put her at high risk. Now, we consider high risk a 20% lifetime risk of breast cancer or greater. And we have different models, and we take that model and we look at a woman's score. And then we think it's important to let women know and to let their primary doctors know that they are indeed at risk of a breast cancer. And if they are at risk of a breast cancer, what are the things they can do to reduce their risk? Are there special tests they need? Do they need MRIs of their breast? Are there lifestyle changes they can make? Are there medications they can take to reduce their risk of breast cancer? And the answer is there are. And we use our nurse practitioners who go over their history and help advise them of all the things they can do to be proactive and help reduce their risk of breast cancer. And for example, we participated in the first prevention trial for breast cancer using tamoxifen as a prevention. And then we participated in the second prevention trial using tamoxifen versus raloxifene as prevention. We have other drugs that are preventative as well. So would a medication, if I had a risk of 50%, I'm making this up, but let's say I had a risk of 50% of having breast cancer, wouldn't I like to reduce that risk in half? Well, yeah. If my risk was 25%, would I like to reduce that risk in half? I absolutely would. That would bring me down to the average risk. The average risk is 1 in 8 in this country, so about 12% risk of breast cancer. So 20% or higher is the area that we'll be looking at.
Great, thank you so much. Now, the Steeplechase Cancer Center also recently introduced a second opinion program. Can you tell us more about how that works and the benefits of the program?
So in a second opinion program, patients can come and have their pathology and their radiology reviewed. We do, as I said, initially have multidisciplinary teams where we review all of our patients, begin with all of the patients that come to Robert Wood Johnson Somerset who are diagnosed with breast cancer. And we also review out patients from elsewhere. I am actually going to be presenting a patient from Australia at the meeting this Thursday. We meet every Thursday morning at 7:30. And one of our retired surgeons, she has friends in Australia, and they've sent us their pathology. So we're going to be discussing it as a group, what kind of treatment and you know, to help give advice. But really for patients, they can come and get advice about the treatment they've been recommended, and it's done in a multidisciplinary fashion. So everybody, you know, I always say 100 are smarter than one. So everybody is involved.
Wow, that sounds like a fantastic program. Thank you. So at this time, I want to be able to open it up to questions and answers from our audience. So if anybody in our audience does have a question for Dr. Toomey, you can go to the chat feature and type in your question, and I'll be happy to ask that of Dr. Toomey. While we're waiting for the audience to have to post some questions, you had mentioned that we participated in a tamoxifen trial, correct?
Mm-hmm. Correct.
So maybe you could speak to this. Tell the audience a bit about who might be an appropriate candidate for tamoxifen. And what
So,
that's
so as a so tamoxifen was the first drug we found to be a chemo prevention agent, meaning the first drug we ever found to prevent cancer. And those would be women at high risk, either a 1.75 5-year risk or a lifetime risk, once again, above the average risk, when once again, the average risk is 12%. So once again, if somebody has a 20% lifetime risk, they would be a candidate to discuss the risk versus the benefits of taking tamoxifen as a chemo prevention agent. So these are for women who have never had breast cancer. So there was a question about insurance, I think, right?
Yes, there is a question up. Does this cover insurance? And I'm not sure if that's, I'm thinking it might be the scalp cooling treatment.
Right.
Just looking at the following
right.
question.
So what we didn't talk about is how much this would cost if we did not have the program we have. So it's not inexpensive, and it is not, unfortunately, covered by insurance. And that's why we have the program that we have to help women who could not afford to get this without our help. So the cap, and it comes small, medium, and large, costs $500. And we can't take a cap from one patient to another, even before COVID, because of regulations, but certainly after COVID, certainly would not be thinking to do that. The cap is $500. For the first 4 treatments, or cycles as we call them, it costs $200. And then cycles 5 and 6 are $150. So comes out to around $1,600 for some relatively routine adjuvant protocols, meaning chemotherapy after breast cancer to reduce the risk of the cancer coming back. And that would be a finite time. There's I guess there's a cap of $2,200. So once you get to $2,200, then there's no more charges. Insurances do not cover it. And although it is in the National Comprehensive Cancer Network guidelines for breast cancer patients, a recommendation to consider the cold cap, insurances have not yet picked it up.
Wow. So thank you for your explanation. Now, the next question is regarding the percentage of people who lose their hair permanently and those who do not lose their hair permanently. So can you speak to what percentage of?
So once again, it depends on the drug. So with most drugs, with most of the drugs, patients do not lose their hair permanently. Okay, so I don't want to make people worry that I'm going to lose my hair. It does depend on the drug, and the drug that we're talking about is docetaxel or Taxotere. So for most other patients, if you lose your hair grows back. As we say, it takes about 6 months that you're happy with it, that you might feel comfortable going without a wig, although people take their wigs off sooner than that. I always say it's a very expensive haircut that they get. And often it grows back. It can grow back a little different, and perhaps the cooling cap prevents that from happening. But so for most patients in the literature, and I've looked at the literature, about 5%, up to 5% with this drug called docetaxel can lose permanently. But I will tell you that is not my experience. It is a very rare occurrence. But once again, if something is permanent, however rare it is, if it happens to you, that's devastating. So that's why for those patients specifically, from a medical point of view, I'm very happy to refer them for that.
Oh, great. Thank you. So, and just to clarify, with the other 2 programs, the breast cancer high risk program and the second opinion program, I guess for that, does insurance cover those 2 programs? How does that work? So
yes, so that would be like any other medical intervention, seeing a nurse practitioner, having consultations. That's no different than any other medical treatment that you would have. So insurance should not be a problem there.
Oh, great. Okay, good. Thank you for clarifying. I wasn't sure by the audience question, so I figured let me cover all bases just in case. So I guess what is the one takeaway that you want our audience to know about, all three of these programs?
Well, the takeaway is that here at the Steeplechase Cancer Center at Robert Wood Johnson Somerset, breast cancer patients can be treated holistically with a multidisciplinary team, and go from radiation on the first floor to my office on the second floor to the breast center and the surgeons on the third floor, all within one place, where we do research to help cure people further down the line. I mean, we want to every day keep moving that ball down the field so that we keep doing better and better. So we have a special interest at the Steeplechase Cancer Center in breast cancer specifically, and all of these programs help our patients with breast cancer. The Paxman certainly can be used for other cancers. Our ovarian cancer patients are using it. Other cancer patients are using it. But for our high risk and our second opinion, that is specifically targeted to breast cancer patients.
Thank you. So this audience member would like to know, how would somebody make an appointment? Who, where did they call? And I guess not specific to any one program. So if that answer is different for each of those programs, if you could clarify that as well.
Well, the good news is, and God bless our wonderful nurses, we have a nurse navigator, Kim, and we can get you the number to call for Kim, but Kim from soup to nuts takes care of our patients. So make sure that they get to the breast center, get to radiation, get to the whatever resources they need. So we do have a nurse navigator that helps people get to the place they need to be. It keeps all of us physicians herded together.
That's very good, very good. So the next question is, can you share briefly the steps you're taking during COVID-19? And I'm not sure if I guess that's really geared towards how you're caring for cancer patients,
right,
during COVID-19.
So well, or any patient coming to the cancer center, when you walk into the cancer, myself included, we walk into the cancer center, we're asked if we have any symptoms, we're handed a mask, which I have right here, and we are, our temperatures are, you have yours, our temperature is checked. For the breast center, the appointments are made so that there's turnover in the rooms where, for example, instead of changing in the changing room, we're now having people change in the room where they have their mammogram done, and then the room gets cleaned. All the common areas are cleaned all the time. Everyone in the cancer center must have a mask. We are not allowing visitors to come with the person coming for whatever they need, unless obviously they need have somebody to help them. So the cancer center is a place where we're all very comfortable in being, and those are the things, and each individual office is doing the same things. We call our patients the night before they come, make sure there's no symptoms, no temperature. We're advising our patients what they need to do.
Oh, good. In that regard, is there any other special care that a cancer patient needs to take amid COVID?
Nothing different than we're telling everybody else, right? The hand washing, the distancing, the mask, the symptoms. No, really, it's the same as everybody.
Okay. Well, great. Thank you for your explanation and clarifying. Appreciate that. So I don't think we have any other questions. So if there No, if there are no other questions, then this will conclude today's webinar. Thank you all for joining us. Thank you, Dr. Toomey. Please remember that the opinions expressed here today by our medical expert are not a substitute for medical advice from your own physician. If you need a physician, please call 1-888-724-7123. And for more information about Robert Wood Johnson University Hospital Somerset, please visit us at www.rwjbh.org/Somerset. Thank you all for attending today and have a great day.
Take care.